In this lesson, we're going to be talking about problem solving. We all face problems. So we occasionally face problems that seem overwhelming, and we might try to cope with them by avoiding them or worrying excessively about them. And these strategies are generally not really helpful, and they do very little to resolve the problem, and it often makes the problem worse. So structured problem solving is a technique that can help you to find solutions to the problems that you face. And with just a little bit of patience, you're going to find that the method is easy to use and it can help you with any problem. So at the end of this unit, you're going to be able to understand the rationale behind problem solving, understanding the steps in the problem solving process, and be able to demonstrate the problem solving knowledge and skills through role play, and know how to apply problem solving skills when counseling drug users. There is an open-ended question in the lesson that I'd like for you to pause the video and answer the question. How do you solve your everyday problems, and what steps do you go through to answer those questions? So, drug users need to find solutions to many problems if they're going to reduce their drug use or abstain from it, and if they're going to make any substantial life changes. And some clients may have so many problems that even their minor problems seem overwhelming. So, for example, a straightforward goal like going to an employment center to meet a counselor and sign up for assistance is going to require them to solve a number of problems. So maybe the client doesn't have readily available transportation or a driver's license, or maybe they need childcare, or the only available appointments that this place has might conflict with other important activities that they have going on in their lives. And so for a lot of clients, their substance use has led them to avoid these problems, or maybe they're making impulsive decisions that aren't in their best interest. And so this poor problem-solving behavior can have negative consequences that's only going to increase the severity of the existing problems, or it's going to create additional problems for them. So the goal of this training is to teach the clients to identify and then analyze and then find solutions to the many problems that they're going to face in their efforts to stop their drug use and to make these lifestyle changes. And so it's our job as counselors to provide a rationale for that component. And people trying to recover from substance use often find themselves confronted by these difficult situations. These situations become problematic if they don't have an effective response to them. And these substance users are likely to encounter several other problems, like finding themselves in places or situations where they've used drugs or alcohol, or having to deal with social pressure, or suffering with drug cravings, or relapsing. And people making positive lifestyle changes are going to incur a couple of problems as well, like having difficulty finding the time to participate in social activities or hobbies, or a lack of transportation, or problems with childcare, or maybe it's job-related issues, or family pressure, or legal problems that they're dealing with. So to solve a problem effectively, you need to recognize that you have a problem. And then we have to think it through and resist the temptation to respond to that first impulse, or resist the temptation to just do nothing. And if you don't find good solutions, your problems are going to start to build up over time, and the pressure may eventually trigger the substance use. And so as counselors, we can explain to our clients that, they have a program to help them become better problem solvers. And it's just going to take some time and some practice to become good at this technique. When do you think you should discuss problem solving with your clients? This is going to be a good question to kind of ask yourself. When is this appropriate? As a counselor, we should only discuss problem-solving techniques with our clients once we have established that they have the will and the ability and the confidence to even take action. Problem solving is going to work best when the client is not impaired, meaning that they're not experiencing withdrawal or substantial cognitive impairment. Otherwise, it's going to be really difficult for that client to concentrate on the discussion. And even if you develop an action plan at the end of the counseling session, they're going to be unlikely to remember it or agree or commit to it if they are impaired. It's best to talk about this problem-solving stuff when the client is in the action or the maintenance stages of change so that you can ensure their commitment to it. And you and your client should divide the problem-solving action plan into small steps. So, what can you do as a first step when your client has a problem? How do you help them in a regular counseling session? Well, first it's going to be important to explain to your client that the problem is normal and it can be solved. When a problem arises, they should be patient and stop and think before taking any action, and then carefully consider the pros and cons of action before any action is taken. The key here is don't rush. And we can teach the client a couple of steps so that they can solve their own problems using an existing problem to kind of help them to practice. So we can ask them to think back to a problem and let's go through the problem solving steps with a problem that you've already experienced. And it's usually not too difficult to recognize that a problem exists. We often know there's a problem because we feel stressed or we find ourselves worrying. And it can be much more difficult to define what the problem actually is. Whenever I do problem solving groups with clients, I'll have them do scenarios. I'll read a scenario to them and have them identify what the problem is. And then come up with brainstorm a list of solutions and then do the pros and cons of each one of those solutions and then pick the best one. Those are the problem solving steps. And what I've found in doing these problem solving scenarios is that the clients often have a hard time identifying what the actual problem is. And if you spend some time thinking about all the different elements of the situation, you can usually figure out what the actual problem is. And if you spent some time thinking about it, but you don't still have a clear definition of the problem, it might be useful to talk them through the problem with somebody that they trust. So, the clients need to learn how to specify or identify the problem clearly. And once they realize that something is wrong, that's when they need to specify it. They should collect as much information as possible to help clarify the problem. So, for example, if the client's upset about their current family situation and they're thinking about leaving their home, you might want to ask a couple of questions here. How is your relationship with your family? Have you received any criticism? And you can ask your client increasingly detailed questions as you focus on the problem. You want to try to get your client to describe the problem as accurately and specifically as you can. So the example here, my partner doesn't like me. That's too broad. We want to try focusing the statement to something more like, my partner doesn't like me working late every night. So one of the vignettes that I do with the clients is there's a young man and he's recently stopped drinking and using drugs, and he has a 3-year-old daughter that he has in his custody, and I don't give information about the mom or the family on purpose. And he does have a sister, and he and his sister recently reconciled and they're working on their relationship, and he is looking for a job, and he has a job interview, and he's wondering what to do about his daughter for this job interview. And he just spent the last of his money buying groceries. So he doesn't have any money to pay the babysitter. And so the question that I pose to the clients is, what can he do about this situation? And so that's the first step, is identifying what is the problem. So what can he do? who's going to watch his daughter, or how can he get some extra money to pay the babysitter? That's going to be the problem that he's working on. So helping them to identify what is the actual problem. And then the next step is to brainstorm some possible solutions. When we're brainstorming, the client should come up with as many solutions as possible. We want to write them all down. We're not rejecting any ideas or trying to think of just the best idea here. We should use our imagination here and think of all the possibilities. Even the ideas that are impractical or not possible may have the elements that are useful. We don't want to evaluate their plausibility until all the possibilities have been identified. So usually when I'm doing the brainstorming part of this, the clients will come up with this really short list, and then I'll keep pushing and pushing. So it's ask the sister, or ask the babysitter to wait for payment, or go get a side job, cut somebody's grass, or something like that. And then I'll have somebody, or I will suggest it, say something along the lines of, well, he could sell drugs. And so I'll put that down on the board, and they'll laugh. And well, he could rob somebody, and so it starts to go out of control at that point. And that's okay, because that's what I'm trying to get them to understand, that it doesn't matter how outlandish it sounds. These particular suggestions, we're not looking at how good or bad they are, or whether we should or should not do them, or that person should or should not do them. We're just writing down as many ideas as we can. And so typically when somebody says, well, he could sell drugs, eventually somebody's going to say, well, he could sell something that he owns. There's something that he could do that is a potential solution that we wouldn't have thought of had that other outlandish particular suggestion been given in the first place. So this brainstorming situation here, this step, is going to be vital for them to separate that I need to evaluate this, whether it's good or bad. And sometimes I hear the clients saying, well, no, he'll get in trouble for that. And I say, oh, no, we're not doing that yet. We're not looking at whether it's good or bad. We're just coming up with with ideas of what he could do. All right. And so we want to stop the client from trying to evaluate, because the brain has a tendency to put those two things together, is to brainstorm and evaluate at the same time. And we often limit ourselves on ideas at that point. So then we want to ask the client to consider the pros and cons of each of the solutions that they have considered. And so for each solution, we want to ask the client to answer a couple of questions. Are there any potential negative consequences, both now or in the future? How much time will it take to carry this out? Is there going to require much money? Do you have the skills to carry it out, or do you have the necessary resources? Does this require the cooperation of other people? And if yes, are they likely to cooperate? Are you likely to face difficulties when carrying out this solution? The solution that you and your client decide upon depend on the urgency of the problem and the difficulties that you both anticipate when implementing the different solutions. So in a situation where the problem needs to be dealt with quickly, your client might choose a solution that can be applied right away, even though this might not be an ideal situation. So we want to consider the consequences. Look at each of the alternatives in turn. What things can your client reasonably expect to result from taking each action? What are the positive consequences? What are the long-term negative consequences? What about in the short term? The client needs to choose the solutions, though, not you. Even the client's choice might not sound the most appropriate to you as the counselor, but it is the most appropriate choice for the client at that point in time. And once the client chooses a solution, they're going to commit to it. And that's very important. It's a client-centered principle that you have to keep in mind, that they are going to choose what's best for them. It's not your job to choose for them. And if you don't think the client has come up with a good solution, you can suggest that they think about what they might do if that approach does not work, and maybe offer some suggestions that you think might be more productive. but you want to be sure not to allow the clients to undertake solutions that appear to be just inherently dangerous. I had a client literally last week tell me that his solution to his problems is going to be that he's going to run and jump on a train, and not a passenger train, but a cargo train that has the chutes sticking out the top, that he can just take the top off of it and slide down into this cargo train. And he's like, yeah, I'm ready to risk life and limb. I know I might, have an arm or a leg chopped off, but I'm okay with that. I just want to kind of bounce around the country. And so I had to say, that is an idea, to travel the country. Have you considered getting a work from home job, something you can do on the computer, and maybe purchasing an RV and driving around the country? So you have some income coming in, and you have a nice place to lay your head and take a shower and store your things, or maybe have you considered just buying a ticket for one of the passenger trains? You're not risking losing a limb at that point, or going to jail, or getting stuck inside one of these trains, and you can't get out. That would be kind of devastating, because then you might die from dehydration, because you don't know how long that train's going to be going without anyone noticing that you're trapped in there. So just providing a couple of other scenarios for the client to maybe think about or consider. We don't want them to make inherently dangerous decisions for themselves. Then your client needs to put their solution into practice in order to address the problem. And a lot of solutions are going to involve several steps. So we want to break that solution down into those steps and determine how and when they're going to carry out each step. And this is how your client is going to set their goals. And so once your client has chosen a solution, you should discuss the next steps and think through their likely efficacy. And you might want to role play the solution before experimenting with the solution in real life. You and your client can't predict all of the potential difficulties that they're going to face when carrying out your proposed solution. So you're going to need to emphasize the importance of evaluating the solution and trying something else if that's not effective. And the progress review will kind of help you to identify any persistent problems. You may need to revise your steps and add new ones. And your client may be more realistic and perhaps optimistic about finding effective solutions to their problems if you can determine a way to measure their success. So you need patience and persistence to solve problems. And always remember to congratulate your clients on both their efforts and their progress. The problem-solving method is not going to make all of their problems go away, nor is it going to solve all problems. But with time and practice using this method, you're going to find that your client's able to better cope and is going to experience less stress when problems come up in their lives. So what I want you to do, this is supposed to be a small group exercise, but I want you to apply the problem solving technique to this problem. I never seem to have time to have fun anymore. I'm too busy with my work. And I would like for you to just pause the video and think about how you would do this. I want you to go through each one of the steps. I want you to figure out what is the problem, which is step 1. Step 2 is brainstorm solutions. Step 3 is to identify the pros and cons of each solution, and then step 4 is to identify what the best solution is for this particular problem. And I want you to answer it in the open-ended question that I have in the lesson. Sometimes in problem solving, you may encounter some obstacles, like the ones in this particular slide. The problem may be poorly defined, or your client may not be able to remember all the steps needed to resolve it. And so in these cases, we need to be sure that there's enough specificity in defining the problem, and try to incorporate a variety of teaching methods to help your client recall the steps that you discussed. A lot of times when they can't come up with the solution, it's because they haven't appropriately defined what the problem is. And in cases where you're not seeing progress in resolution, you want to consider whether or not the client's really in the appropriate stage of change. And if they're not, you want to consider some motivational interviewing to maybe help them get there. Otherwise, you may want to consider whether or not your client may lack certain skills to achieve what they want to achieve. In that case, you may want to examine the cognitive capacity of the client or try using some other teaching or recall aids. And sometimes you begin with a problem that may seem too difficult for the client to solve. And in these cases, we need to revert to some easier to solve problems so that your client may gain confidence in their ability to solve problems. In other cases, you may find that your client begins to evaluate solutions during the brainstorm. They have a problem separating those two steps. And if that's the case, it's going to be important for you to go back to the rules and explain why it's critical to evaluate only after you've tried a solution. We don't want to evaluate whether it's good or bad or if it's going to work. We want to try it first. And sometimes the client's slower than you expect, and you may end up doing more work than you expected to help solve the problem. And this is actually quite common in the early stages of problem solving, and it's to be expected. So try to move toward doing less work as you begin to solve more difficult problems later on in your sessions. Some counselors forget that the aim of teaching this technique. Please remember that your job is not to solve all of the client's problems, but to help the client learn how to solve their problems on their own. You are the midwife. You are helping them have their baby. You are not having the baby for them. This is a good exercise for you to practice with your clinical supervisor in maybe a group supervision session. So there is a handout in the lesson, and you should do this with groups of 3. It works best. And the 3 people are going to play the roles of counselor, client, and observer, or the observer can be the supervisor. So you're going to, as the counselor, you're going to have the problem solving worksheet, which is the handout in the lesson. I think it's labeled 5.2-1, and explain that the counselor is going to guide the client through the problem solving steps that were outlined in this unit, and the observer is going to watch. And the client should be in the problem recognition stage and identify the problems listed in this particular slide, one at a time. And so you, as the counselor playing the counselor role, should ask the client to describe their problem as accurately as possible and brainstorm some solutions, and then assess any alternative solutions, and then select a solution and make a plan to carry out the solution. And then after doing one problem, you can switch roles and play the role of the client and allow somebody else to play the counselor, or you can be the observer there and give your feedback afterward. But the 2 problems are, when I feel upset, I end up using heroin, and then the other problem is, when I meet friends, I end up using heroin. So you can role play through that. And there's also a cognitive behavioral therapy role play treating heroin use. That's a good role play for you to watch, and I've actually included it in the lesson. So in summary, a lot of clients have difficulty solving their problems. And so by teaching your clients problem-solving techniques, you can assist them to solve their own problems. And be sure to remind them that problems are normal and they can be solved. And you want to help your clients to be specific in identifying their problems and identify the best options by looking at the pros and the cons and the plausibility and the effectiveness of those solutions. And you want to kind of help your clients to think through the implementation process. So for this particular lesson, please be sure to answer the 2 open-ended questions in the lesson and look at some of the resources, watch the YouTube video that I've put in here, and try and practice this role play exercise that I've provided for you. It's going to give you a better understanding of how to work through this problem solving process with your clients.